I'm an admissions representative here at George Mason for our online Master of Science in Health Informatics. I'm here as a resource to give information, answer questions, and walk through the admissions application process as well. If this is something you obviously want to move in the direction towards in terms of applying for our program. So here is our agenda for the evening. To start, we are going to meet with our presenter. We're going to focus on why George Mason might be a good fit for you in terms of the Masters in Health Informatics program. We will also go over curriculum details and learning outcomes, and we'll finish up with a focus on admission requirements, and there will be a Q&A portion as well. And a few housekeeping items here as well that I want you to review before we jump in. Feel free to use any of these features this evening. We have our chat function. Feel free to use that as we go through the evening here. In your controls at the bottom window, click chat for the chat window to appear and type your message. And we will go through that usually at the very end of the webinar, not typically during the actual presentation. You may also wish to raise your hand if it's a more pressing question, but again, we do prefer if you wait towards the end of the webinar. And of course, please do share your questions in the Q&A function, and we will address those questions towards the end of the webinar. And you're free to kind of use those tools, during the actual presentation, so we can have those ready at the very end. All right, without further delay, I would like to hand over to our presenter this evening, Dr. Janusz Wojtuszak. I'll hand over to you. Thank you so much.
All right, thank you very much. Welcome to the information session, and I'll be happy to share with you information about our master's program. All right, so there are lots of reasons why we are unique and one of the best programs in health informatics. We are CAHIM accredited. You probably already checked out CAHIM website. This is accrediting body for health informatics programs. There are currently, I believe, 26 accredited programs across the US. We were the 11th program. We are the first and only CAHIM accredited program in Virginia and in DC capital area. We have a very flexible format for online classes, and courses are taken in condensed 8-week format, in which the content that is usually presented in 15 weeks for on-ground students is condensed into 8 weeks, but students take one course at a time, and you can really focus on taking this one specific subject. We have great instructors that deliver content of the courses, and these are usually the same instructors that teach on-ground courses and the ones that actually develop the content of the courses. We have, well, very competitively priced curriculum, and you can, and probably you did check out prices of other programs elsewhere, and you know that our pricing system is actually quite competitive as compared to other programs. The program can be completed somewhere is 22 to 28 months. The goal is to have you out of door in 2 years, and that can be a little bit shorter if you're coming with strong background that is related to the program. But this is something we can discuss in detail when we talk about specific curriculum. Next slide. All right. So this is the core curriculum of the program. This is what everybody takes. There's a tiny change that happened very recently, and this is something we're very proud of. We have recently became the first and only College of Public Health in Virginia, and because of that, the first course that is listed there, HUB 678, Introduction to the US Healthcare System, has been replaced by the Introduction to Public Health. As a College of Public Health, we need to deliver public health content, and that is done in the course that is replacing the first one, which is in here. You still get Introduction to US Healthcare System, but it's not in its standalone course. It's been spread around other courses that are required. HUB 618 is the course I personally created, computational tools in health informatics. What it gives you is the introduction to computing. So you learn things that every IT professional and every computer scientist actually know. And on top of that, we teach you how to use Python to do programming, mostly focus on using internet data. but you've got to be able to program in Python or other programming languages. One we actually use mostly in the program is Python, and this is skill needed across other courses in the program. Now, a side comment in here, on the admission, we do not require you per se to have computer science or IT skills. However, once you're admitted to the program and you do not have those skills, we ask you to complete a bridge course, and that bridge course prepares you to be proficient in computer use, have just a little bit of programming skills, just a little bit of database skills, have some informatics knowledge. It reviews some math that for many of you is long forgotten for a long time. So for those that come with some computing skills, we don't ask them to do bridge course, but many of you come with either healthcare related or other type of background for which we ask you to complete the bridge course. Again, not exactly required, but you're strongly encouraged to do it. And the completion of the bridge course makes your life easier once you get to the first courses in the program, especially computational tools and other courses in there. Introduction to Health Informatics, very standard course. Healthcare databases, that's mostly an SQL course that teaches you how to query databases. Data and standards. This is all about data. This is all about making sure that you understand ICD codes, what are ICD-9s, what are ICD-10s, what are HCPCS codes, what are MDR codes, how those things are related through large coding systems like large ontologies like UMLS and so on. At the end of the program, all students are required to complete pre-capstone and capstone. Capstone is really about sending you to complete an internship out there in the community. What's different from a typical undergraduate internship is that you work on a project that is agreed between Mason and the partner out there, and you need to deliver, and you need to work on that specific project, deliver, write a report, make a presentation at the end, and so on. So it's a project specific experience that you complete usually if we in an outside partner outside of the university. Next slide, please. All right, we have two concentrations. Concentration in health informatics management and concentration in health data analytics. Those two concentrations are offered in the online program. Health informatics management is about managing health informatics projects. It's about healthcare security, privacy, understanding of the policies, understanding of legal issues, understanding how health informatics fits into larger scope of organizations, mostly healthcare organizations, but also vendors from more managerial perspective. And that concentration gives you, in addition to some required technical skills that every health informatician needs to have, it also gives you soft skills related to project management, be able to interview customers, talk to the customers, talk about projects, and so on. It serves as what health informaticians often do is serve as this interface between healthcare and the IT worlds. On the IT side, we have all the programmers, administrators, all the other strictly IT personnel, and they do not understand clinical world, and clinicians do not understand the IT world. And lots of the work which is done in health informatics is being able to bridge the gap and interface those two. Having said that, there are lots of things that are specific to health informatics, things like data standards that neither side actually understand. And quite often you work on projects in which you can get in one room health IT people and the IT people and clinicians and healthcare administrators, and they can't talk to each other. They don't really understand the data. They don't really understand other things. And even though there's a combination of technical and clinical skills, problems cannot be really solved. So health informaticians are needed in that mix to bridge the gap. The second concentration, health data analytics, it's really data science in health program. So this is about getting you the hard skills and understanding how to take medical data and healthcare data It could be EHR data from electronic health records. It could be medical claims data. It could be survey data. It could be medical registry or something like cancer registry data. And apply analytics techniques. This could be what people refer to right now as AI methods or machine learning methods, or they could be more traditional statistical analysis methods, or they could be some combination of the two, and be able to extract data or extract information from those massive data sets, or often massive data sets, go through some processing steps, and actually build some models at the end and find out how those models can be implemented as a decision support system, for example, that supports clinical use. So it is really about data science in health program with hard skills, quite technical concentration, and one of the popular ones among our students. But those of you that want to end up with hard technical skills should go after data analytics. And there is a coursework related course inside. Both have statistics, but the technical one will have things like data mining, statistical process control, comparative effectiveness, while the less technical informatics management concentration would have things like privacy, security, organizational behavior, or legal issues. All right, next slide. It's a myth to think that health informatics graduates work in hospitals. I've been approached by many students in the past, saying we're looking for a job, and actually, there are no health informatics jobs in the hospitals. Yeah, that's partially true. Hospitals don't often advertise health informatics jobs. And many of our graduates from our program actually do work in hospitals, but quite often these are the ones that were already there in clinical or other positions, and they stayed and moved to informatics positions. Where most jobs are for health informatics graduates from our program is health IT vendors. Right, you still work for hospitals for hospital data, but you're not exactly a hospital employee. You're actually a vendor or a contractor or a consultant working for a hospital. It could be IT vendors, could be analytics companies. A good number of our graduates actually do health analytics and health data science work, working for those analytics companies. Some work in consulting firms. Some do work in hospital and clinics. Other insurance companies, research institutions, public health departments all over the place. If you look at any major company that does anything related to health informatics, health IT, specifically in DC area, there are graduates from our program in there, and there are many more graduates in those companies across the nation. And those are mostly graduates from the online program that are across the nation. Now, when you're looking for specific jobs in health informatics, you go to LinkedIn or you go to other places, you find very few that have health informatics in the title, and those will have everything ranging from health IT consultant, health data analysts, to health data scientist, to health IT project manager, to anything else. So the job titles are all over the place, but if you look at specific job requirements, those are clearly aligned with what we teach in the program and what are the program competencies. All right, next slide. So here's the process. You need to have a bachelor's degree with a minimum of 3.0 GPA, submit your transcripts, letters of recommendation, statement of purpose. And I can talk about that a little bit more if we have time later, and you just apply.
Yeah, and just expanding on that as well, before we jump into the Q&A portion here, if you have any questions, regarding the next steps as far as start dates, application materials, anything like that, please do reach out to your admissions representative. If you don't know who your advisor is, I will be sharing the main number on the final slide, so you can definitely reach out to the main office to get connected with your admissions representative, and your advisor, your representative, will be able to address anything you're missing in terms of application fees, start dates, things like that. So please do reach out, and as we just mentioned, a bachelor's degree is required at least a 3.0 GPA. If your GPA is slightly lower than a 3.0, you can include a GPA addendum in your application as well, where you get to kind of explain why that GPA might have been a little bit lower, and kind of fill the gaps in a little bit for the admissions team. Of course, transcripts are also required. We can use unofficials for a decision as long as they have some key bits of information included, and we can always request the officials on your behalf as well. So that's a pretty simple process. And then, of course, your resume, 2 letters of recommendation, of course, no family or friends, but we do require at least 1 to be from a current or previous supervisor. And the second one can be the same thing, or it can be a colleague, something like that. So we do require 2 letters of recommendation. And then finally, a statement of purpose of a word count of 750 to 1,000. And you're shared the prompt, as you kind of go through the process with your admissions representative as well. So that's just the general direction that you'll be taking if you were to apply for the program.
Yep, I want to add a couple of things about this statement of purpose. It's really about the purpose and the goals that your goals in the program. So I've seen very nicely written letters that talk about everything but your actually goals in health informatics, right? So just make sure you're as precise as possible and be as precise as possible why specifically Mason program and why our curriculum, why our courses, why our faculty. Right, you may not know exactly details of every single course, although lots of this information is available online. Just try to do some research and try to find out, why this is a good fit program for you, because we very carefully read those goal statements. And this is quite often, the admission decisions are based of what you actually write in there. And this is specifically important for those that come from non-informatics fields. Those that actually change careers. So again, also feel free to reach to the representative or to myself if you have any questions, how to write it. And we'll be happy to answer.
Absolutely, yeah. Fantastic. All right, so we are going to move on to the Q&A portion here as well. We haven't got any questions just yet. This is your kind of chance to ask any questions that might have come up as you were listening to us or kind of going through any research on your end. And you might want to take this time as well to just jot down the details on the screen here. You have the phone number for the main office. You also have an email address if that's your preference. And of course, you have the website as well that you can reach out and make an online appointment or put an online query as well, should any questions pop up along the way after this webinar. So I'll give you a few more seconds here. If anybody wants to ask any questions, and if not, we will finish early. All right. Nothing is coming up at the moment, Dr. Vatushak, so I think we might go ahead and finish here. But again, if you do have questions that come up, please do reach out to your admissions representative. I want to thank everyone for their time this evening. Of course, Dr. Janusz Vatushak, thank you for your time as well. Appreciate you being here. And again, last call for questions from any of our participants. All right, I think we'll wrap it up there. Thank you so much, everyone. Bye-bye.